Hi there, my name is Abby, and I'm a 21-year-old junior in college currently at the University of Mount Union. And I wanted to answer the question of what I would tell a parent who's trying to get their child into mental health or substance abuse treatment. So I grew up with a single family household. My mom was my sole caretaker. My dad passed away when I was young. My brother was adopted from Vietnam before I was born, so he's a couple years older than me, and he struggled heavily with substance abuse issues. He was in and out of juvenile detention centers throughout my childhood and my adolescence, so that kind of, he had some abandonment things going on that kind of affected me, and so my perfectionism and kind of just how I grew up turned into some pretty prominent anxiety issues that showed heavily as I made the transition to college and started to have to be independent. I'm also a collegiate athlete, so that is a struggle that if you have a child who is an athlete, a child who is a perfectionist, or a child who feels the need to perform, getting that kind of help you need is extremely important. I've had this conversation a lot with my mom. She's my biggest fan and my biggest supporter, and one thing we always talk about, and she always talks about how she regrets not having the taboo conversation that is mental health or addressing substance abuse, especially with my brother, earlier. And so she talks to me constantly on a constant basis about how she wants me to make that change when I'm a mom, and that's something I find to be super important. I'm going into the field of education, and I also am going to be giving back to my sport in the form of coaching. And so it's super important to have those conversations and make it a topic that is super prominent to your kids and make them knowledgeable about that. Growing up, in high school, I supported the Complete Athlete Foundation, which is a foundation that focuses on getting a House bill passed in the state of Ohio that we wanted to get mental health training for coaches. We need to make it a more common topic. And if I were to be talking to a parent, the same thing I'd say to my mom. Sometimes she gets frustrated and she's like, I know I'm a mom, but I messed up. Just do it. Just have that conversation, because I know it's hard. I know it's hard to admit that you think you did something wrong or that something is wrong, but you're not wrong for having a mental health issue. You're not damaged or dirty goods for having a substance abuse issue. And getting that help you need can change the trajectory of your life. Getting my anxiety treated changed who I am today. I was a member of the Dean's List last semester. I got my anxiety regulated and under control. My brother is working a full-time job, and me and my family have the best dynamic we've ever had. So just do it. I mean, it's the best decision I've ever made to get medicated and get that help that I needed, and to get my brother that help that he needed. And it's truly changed us for the better. So yeah, thank you.